Jordan, very good to see you. An interesting topic today. The three big medical costs that retirees tend to underestimate. If you are retiring soon, you should probably budget more for healthcare than you were thinking. According to a recent Wall Street Journal article, there are three costs that they are spotlighting that retirees often overlook. Number one, not going to surprise you, Jordan, medications.
Medications are expensive. They
Yes.
go up rapidly. It's kind of hard to keep a cost control of that. And inflation in healthcare is ridiculous, I would say personally. But we actually, for those Part D, the prescriptions and different things in Medicare, we actually have an entire team that reviews that, our Medicare team, to make sure people are on the right prescription at the lowest cost, and then they
Yeah.
make sure that their plan covers that. So it's something we want to be proactive on and not kind of be a leak in our financial bucket.
Mhm. Next, we have what the Wall Street Journal is calling medical isolation, higher costs in areas with limited healthcare access.
Yeah, so if you live maybe in a farmland or somewhere maybe not by a metropolitan area, it might be a lot more expensive to get the healthcare you need, and you got to factor those costs in,
Yeah.
or maybe just make sure that there is even good healthcare in those outside the major areas.
And next, we have concierge care. This is becoming increasingly common. In some areas with large, affluent retiree populations, doctors are increasingly turning away patients on Medicare and accepting new patients only if they pay an annual fee. This is averaging $3,500 a year.
Yeah, doctors are, I think they're getting sick and tired of the medical system and going through insurance and collecting payments. They're wanting that top level service and they want to get paid top level dollars for that. So
Mhm.
if this is something that somebody's looking to get and they want that concierge high level service and pay out of pocket, you got to know that and have a plan for that because
Right.
that can be very expensive. I
Mhm.
will say personally, I've talked to a lot of clients and I've helped guided some clients that actually have moved to different countries to get very good care, very good kind of environment and facility. And it was actually better than the care they were getting locally, and they actually pay less money for it. So there's a lot of options out there, but that doesn't fit for every person. Know
Mhm.
what you want, and then have a plan to accomplish and plan for that.
I like that. Give me a good doctor and access to a beach, and I think that's where I would retire.
Win,
So,
win, win.
bottom line though, Jordan, healthcare in retirement isn't just about insurance, it's about having a plan.
Yes, you got to have a plan when it comes to healthcare. You got to know where you want to go, and then have somebody to provide the financial leadership to get
Yeah.
you there.
Mhm.
And that overlays we were just talking about earlier. Be by the beach. If you have a healthcare plan where you're going to go to maybe Costa Rica and all your family's going to visit you, great. But make sure you have a plan in place. You can't leave things up to chance. And when you do, everything goes smoothly, and all the financial matters fall into place.
Mhm. Well, Jordan, again, I always enjoy talking to you. I learn a lot. If somebody would like to sit down with you and learn more about creating a plan that takes all of these variables and unknown costs into account, what's the best way to reach you?
Yeah, give us a call. We'll analyze everything. We'll put you in the right track. Our main number is 847-499-3454. We love helping people and love a chance to have a conversation and see how we can help you.
Jordan, thank you. And everyone else, stand by for the QR code.